Welcome to another module of the online diabetes education. Our goals in this module are, on the one hand, to motivate and encourage you to find people who have a diabetes risk or an undiagnosed diabetes. On the other hand, we would like you to know how to diagnose diabetes and special diabetic conditions. One of the main challenges today is that there are many people having diabetes in your environment who are not diagnosed. Those have a very high risk of later suffering severe complications of diabetes. The only way to offer them a good treatment and intervention is to diagnose diabetes risk or diabetes as early as possible. To do this, it is important to know how to diagnose diabetes, and it is important to know what to tell the person what this diagnosis means to her. This is the core content of the following module. My personal goal for you is that after working through this module, next time you meet a person who maybe is having high diabetes risk or who may even have diabetes undiagnosed, you know how to handle this situation. We will start in this module by explaining the different classification of diabetes. In the next step, we will introduce the different methods of diagnosing diabetes to you. We will guide you through the different tests, the usage and the meaning of the test results. Then we will introduce the FitRisk test to you. This is an easy to handle questionnaire and a score based on 8 questions the patient can answer, and it will help to identify the individual diabetes risk. Then we will explain prediabetes as a precursor of diabetes to you. It is important to find people who have prediabetes because you can help them in motivating them to change their lifestyle and by this help them to avoid diabetes from developing. Finally, we will have a deeper look into type 1 diabetes and also gestational diabetes. It will give you a perception about how to diagnose those special diabetic conditions. For example, to test ketone bodies in type 1 diabetes or to test pregnant women between the 24th and 28th week of gestation. Diagnosing diabetes as early as possible is of direct benefit for our patient. If they are receiving a personalized and individualized treatment in time, they have a very good chance of avoiding diabetes-associated complications. So again, my personal wish to you is that the next time you might think that the person you meet may have diabetes risk or may suffer from diabetes already, you test this person proceeding through the steps you have learned during this module. Even if you test 10 people and 9 do not have positive test results, you will help this 1 out of 10 persons enormously. So it's worth to learn this and it's worth to diagnose diabetes risk and undiagnosed diabetes. I thank you very much for attending this module and your attention.